Good afternoon, everyone. Thank you for tuning in today. My name is Jeff McKay with Brightsquid. With us today, we have Rohit Joshi, Brightsquid CEO, and Dr. Frank Dickey, who is a big user of secure mail in the clinic. So let's dig into that right now. Welcome, Rohit, and welcome, Dr. Dickey.
Thanks, Jeff.
Thanks, Jeff.
So you're at Providence Pediatric Cardiology. You guys have been using secure mail for a while. You've been a key advisor for us in some ways as well. So much appreciation for that. And as I understand it, there is a blog post. You can read a little bit more about how secure mail fits into the clinic. We did an interview with your office manager, Colleen. And just talk a little bit about how you got to these. You're at 7,000 messages sent. You've invited 7,000 patients. How does that fit into your clinic as people come on board?
So one of the things that we've instituted with the secure mail is to make it part of the entire patient process. And so when we see patients coming in for the first time, they're invited to join the Brightsquid email communication. We call it kind of a system. And the way that it's presented to them, that this is a way and an opportunity to communicate with the clinic and with the doctors, if need be, during the process of the evaluation of the patients. And so people are actually quite keen to join up to this, and we've had pretty good acceptance of the technology. And the general idea of being able to talk directly to care staff using the email platform has actually been quite well accepted and used. And so right from the beginning, it's introduced as part of our overall clinical process. And so once the patients are evaluated, if they need further testing, further follow-up, further information, then certainly we can use the platform to do that.
You know, it's interesting, Dr. Dickey. One of the concerns that we hear from clinicians that are sort of connected to it, and I would think that looking at pediatrics would be a particularly sensitive and nerve-wracking for the parents. And one of the concerns that we've certainly heard is that, in fact, with greater access means that the demands of your time are going to be greater as well. And when I look at the pediatric world, I believe that caregivers, parents, are going to be very, very are going to use this channel, more than maybe you would like them to almost. And I know that I think we probably talk about that later, but I don't know if you have any early perspectives of this, because clearly the subject matter being the child, the details and time sensitivity of those are super important.
So you're right that in the pediatric world, of course, the parents are quite concerned about their children, and certainly if you give them a new diagnosis or potentially even the information or the news that their child may need to have surgery, it's quite traumatic for the family and quite perplexing, and they'll always have questions afterwards. And it's great because when we're actually having the conversation with them in the clinic, you only have so much time to speak with them, and they may have lots of questions. But if you let them know that they can touch base with you through this platform to ask any questions that they may have, so that we can answer all their questions and try and relieve all their anxieties, they actually feel more comfortable just continuing on with the conversation, knowing that they have that ability to contact us. Like, it's not over when the appointment is over. They have the ability to do that. And having said that, I've actually found people are super respectful of your time. So it's truly a few patients that will end up contacting you, wanting some more information and wanting some more details. And so in terms of the amount of time that it puts on my schedule, it's actually very little. And that goes for also contacting patients for other reasons. I mean, the amount of time savings is actually quite significant, because trying to reach somebody on the phone and then getting them on the phone, and then speaking with them on the phone and then documenting all that afterwards in the chart, when you add up all the time for that, it's much quicker to respond to specific questions in an email. And yes, sometimes there will be 2 or 3 emails, but the time commitment to answering those emails is considerably less than having to contact the family via telephone, speaking with them on the phone, and doing all that sort of things. And at the end of the day, people are extremely respectful of our time, and I've not found it an issue actually that it's taken more of my time. In fact, it's saved time for me.
That's so interesting. You know, when we first started down the road of trying to create this product, I actually visited your clinic, and I met with a parent who had literally a binder full of information about their child, and you could see that a lot of it was handwritten notes. A lot of it was, you know, there was yellow stickies that were, you know, helping tab all of this out. And it made me do a couple of things. You know, the first was respect how important this event, this discussion was going to be with their physician, with their cardiologist, or child's cardiologist, I suppose. And second was, boy, this is we have an important job here to do, because, you know, this is no way to manage. This binder is no way to manage patient care.
I mean, I find that parents who really want, and a lot of parents these days come into clinic with quite a bit of information that's now available on the internet and all other.
Right. Dr. Google.
It's Dr. Google. It's often funny. They come in and they already diagnosed their kid. But anyway, that that just having that open door really relieves a lot of their anxiety. And so they carry on. Some of them will take notes, and some of them take those notes, and some of them, will contact me afterwards. And so, providing advice is one of the roles that we've used it for. The second thing is some people are moving to a different country or a different province, want to have their information. Certainly, this is the second big use that we've had with this platform, is that we can now confidentially pass that information, their results reports, their clinic notes, and anything else that they might need. And it's a very simple way to do it. And even if they've already moved to the new province, it's a very easy way of connecting with them to allow them to carry on with getting their care in the other province.
Now, so when we talked to Colleen about your use, one of the things you really appreciated about the CureMail and how you've implemented it is that there's a really good assurance that patients are getting the exact information they need. So when you send a message directly to the patient, or they send a question to you and you respond, there's no sort of game of broken telephone there. There's no lost in translation. Can you talk about how important that is and the benefits of that to your clinic and the patient outcomes?
Well, I think it's always very reassuring to them that the information actually got to the doctor and the doctor actually responded, because you never really know when you call up, and if you don't speak directly with the individual and you're getting the information secondhand, are you getting all the information? Are you getting the correct information? And the nice thing about an email, it's in black and white, and it's coming directly from me. So there's those kinds of things, those kinds of questions about am I getting the right information? Is it correct? Again, it allays a lot of those concerns over the entire communication process.
Great. Yeah. So, we talked about this respectful patient use, and the easy way to illustrate this is you look at the CureMail user base across Alberta. There are 7,700 healthcare professionals in Alberta using CureMail. There are 140,000 patients on the system. In the last year, we've sent almost 500,000 messages in Alberta between providers and patients. Those 7,700 providers, 77 healthcare professionals, so providers and staff, have sent almost 80% of those messages. So you can see that the volume, and on average, if you look at it and space it out, patients send about a message every 5 months. Obviously there's variability in that. So we continue growing. There's lots of research you can look at about this. I think from my perspective as a parent, I've been in the situation where I just needed a quick answer from my family doctor. It took 8 interactions back and forth in a week of time, where it could have been a secure mail message that I sent with a photo, with a question, and a response from the doctor. And that's really all it turned out to be. It could have been that simple, but it was drawn out. So I do appreciate your use, and I see the use case as being really strong. I will point out before we get to the last couple slides here, there is a question panel in your go-to webinar control panel for everybody watching today. So please feel free to enter some questions in there, because we're going to get to those in a minute. And we try to stay respectful of our time. A quick note, so SecureMail has a number of features that you can reconfigure. So in your settings page, if you look here under your clinic settings and under your individual settings, you can check this box that says allow patients to message you. You can uncheck that box. So, I think Dr. Dickey, for you, if there's times where, you can't respond to messages, or, you need a much deserved break, or, some other thing, this is something that can be checked off. And what happens with those messages is they don't disappear. Those messages are redirected to the staff inbox, where the staff can manage it, which happens, we call it the shared inbox. So then anybody who's monitoring that can address and triage those messages as appropriate. And it gives people the flexibility to be able to turn those on and off. If you're on call, if you're off call, that sort of thing. So make sure you familiarize yourself with that if that's a concern. And our support team is always available to help with that. Different things, professionals, you can allow them to manage you as well, and whether or not you receive notifications. That brings us to the end of the formal presentation. I will say, like I said, you can reach out to support for any help. And there are other Clinic Innovator webinars, articles available. You can hear directly from clinics what they've done, how they're using SecureMail to help their clinic. Just right here under the SecureMail tab on brightsquid.com, there's the Clinic Innovators section. So we do have a couple of questions for Dr. Dickey. Dr. Dickey, what do you think about staff time? Is SecureMail supportive of giving staff more time? Is it extra work for staff? How does that work in the clinic?
I find that it, again, has been saving time because of the lack of the need to contact somebody by phone. As you said, with your own experience, it took you a week to get something sorted out through your doctor's office of playing phone tag back and forth. Maybe the person you're calling is not home, and then that message doesn't get through and they don't call back. At least if you send a message, you know where it's going, and you know that it gets there, and that can be followed up on quite easily as well with minimal time. So the staff actually really quite like using it.
Great. And so we do, another question here. In terms of fee for service, so we work in a fee for service environment. There are codes that apply for SecureMail. So for dispensing advice through SecureMail, there are codes 0301F, I believe, as well as doing consultations. How does that factor into how you use SecureMail within your clinic, balancing that with patient access and outcomes?
I mean, it doesn't really factor in a sense that it doesn't change the way that I practice. So I continue to practice the way that, but it's nice to actually get a little bit of compensation for your time. And so the clinic staff is already trained that when an email goes out regarding a patient communication, the staff automatically bills that as an e-communication, and so that does bring in your money. It doesn't really change my time at all because we've worked it into the overall clinic process, and so it's not a huge amount, but it's better than nothing. Which again, if you were to make a phone call and then have to document everything and then build a phone call, all of that stuff takes time, and we've almost it almost automatic with the messaging system.
Great.
Fantastic.
Well, that brings us to our end, and I want to be respectful of everybody's time. We do have a couple other questions. We'll do our best to answer those offline. So Dr. Dickey and Rohit, thank you very much for your time today, and everybody, thanks for tuning in, and we'll see you next time.
Great. Well, thanks again for everybody, and thank you very much, Dr. Dickey. We'll talk soon.
Okay, thanks guys.